Hi, are you preparing for a medical receptionist or virtual medical assistant job? One of the biggest reasons the candidates fails interviews is not because of the medical knowledge, but because they don't know how to speak professionally with patients. In this video, I will teach you 10 English phrases that every medical receptionist should know. By the end, you will sound more confident and professional on every patient call. So, hello and welcome to Skills Hub. My name is Nair, and on this channel, you will learn practical healthcare communication skills, medical English, interview preparation, and real world patient support techniques. So, let's begin. So, we'll begin from the phrase number one. What's the phrase number one? Patient calling you. Okay, we'll set up a scene here. Patient is calling you, so you're answering. Thank you for calling. How may I help you today? Thank you for calling. How may I help you today? This is the standard professional greeting used in every medical office. It sounds polite, welcoming, and respectful. So, thank you for calling ABC Medical Clinic. How may I help you today? Well, the patient says, I would like to schedule an appointment. Okay, yep. So this was the first introductory or the opening phrase. Secondly, may I have your full name, please? The patient's identification always comes first. We have to identify the patient. Sometimes the patient's new, sometimes the patient's already established, and he or she is present in our EHR or EMR systems. So, may I have your full name, please? Patient replies, Sarah Johnson. So, phrase number three, could you please verify your date of birth? So, I said the patient's name was Sarah Johnson. There are a lot of Sarah Johnsons here. A lot of hundreds, thousands Sarah Johnsons. So, how would you identify the correct patient? By the date of birth. So, could you please verify your date of birth? So, now you have the first name, last name, and the date of birth. Okay, you can also say, may I have your first and the last name, please? And could you please verify your date of birth? So she says, or he says, March 15th, 1988. So we'll go to phrase number four. Please hold for a moment while I check. Well, this is very important here because if you don't mention the patient that you're putting her on a hold, it's kind of disrespectful. And we always have to say, please hold for a moment while I check. So the patient knows that you are going to check her name in the EMR or the system, because they don't know about the EHR or the EMR systems. They know that we have a software or we have a system here. So please hold for a moment while I check. You can tell the patient that the doctor has an opening on Monday, August the 3rd, 10 a.m. As that sounds natural and is commonly used in healthcare setting. So the doctor has an appointment on Monday, August the 3rd at 10 a.m. Phrase number six will be, would that appointment work for you? Because you are just offering or mentioning some of the appointments, the nearest appointments to the patient. That might work for the patient, or she might be busy at that time. So you have to ask, would that appointment work for you? She says yes, or she says no. If she says yes, the phrase number 7 will be, your appointment has been confirmed. Once you have scheduled the patient's appointment on the mentioned time, okay, you have to confirm the patient that your appointment has been confirmed for Monday, August the 3rd at 10 a.m. Phrase number 8, you have to mention that a patient that please arrive 15 minutes early. It's because patients may need to complete some paperwork or update their information. There might be a change in their insurances. So please arrive 15 minutes early to complete your paperwork. Phrase number 9 will be, thank you for your patience. You can use after a wait or a delay to show appreciation. Thank you for your patience while I looked into that. And the last and the closing phrase, which is the most important thing, as the first phrase was, is there anything else I can help you with today? Listen, this is actually a professional way to end the conversation, while giving the patients another chance to ask questions. They might have another questions like, may I know where the clinic is located? Or they have several questions in their mind if they are coming to a clinic. So about past labs or medications. So great job. You now know 10 professional English phrases used by the medical receptionist every day. You can practice these phrases until they feel natural. Well, this is just a video I'm uploading here, and we have to sound natural actually, and while having a conversation with the patient. This is everybody thinks actually it might be an AI, and AI is talking to us, or we are having a conversation with an AI. Most of the people, they don't like AIs. So always feel natural. They will help you communicate confidently with patients and prepare for interviews as well. So if you find this video helpful, please like, subscribe, and turn on notifications so you don't miss my future lessons. And also comment below which phrase was your favorite and which one do you use the most. Thank you for watching Healthcare Skills Hub, and I will see you in the next video. Thank you and bye-bye.